Hi beautiful people, welcome back to my YouTube channel. If you're subbing for the first time, you're welcome. My name is Luna, and on this channel we create content on faith, on nursing, on health, as well as makeup. These are the kind of contents you're looking out for. Please do not hesitate to like, to share, as well as subscribe to the channel. Now in today's video, we're going to be discussing a condition that some women experience during the period of their pregnancy. I don't know if you've come across women with exceptionally swollen feet or swollen legs, puffy fingers, puffy face especially. Such women may be experiencing pre-eclampsia. Now, what is pre-eclampsia? Now, pre-eclampsia is a complication in pregnancy that is characterized by having high blood pressure, having excess protein in the urine, which we call proteinuria, and this usually occurs from about 20 weeks of pregnancy. Now, what are the symptoms of preeclampsia? Preeclampsia has several symptoms. One of such is high blood pressure. Now, women who have high blood pressure in pregnancy, the first line of thought would be, did this woman have high blood pressure before she got pregnant, or this high blood pressure came up during the period of pregnancy? Also, there are other factors that may be put into consideration before they say, okay, this woman might have pre-eclampsia. Also, another symptoms of preeclampsia is severe headache. With high blood pressure comes severe headache. Both of them come together. For people who are hypertensive, you will understand. High blood pressure, headache, they come together. There's very blurry vision, shortness of breath as a result of presence of fluid in the lungs, nausea or vomiting. Nausea is a feeling of vomiting, and then they might be vomiting as well. There is edema. Edema is swelling of the body. Usually for such women who have preeclampsia, they have swelling on their feet. Their fingers are looking puffy. Do you understand? Like swollen. Their face also is looking puffy or swollen. So for such women, these are the areas where you have the edema concentrated. Thrombocytopenia, which is decreased level of platelets in the blood. Now we have the red blood cells, the white blood cells, and the platelet, which makes up the component of the blood. Okay, so for women with preeclampsia, they usually suffer from this. Sometimes they might experience abdominal pain, and also there is protein in their urine. Now, there are some defining symptoms that once a pregnant woman presents with such symptoms, you can tell that this woman has preeclampsia. They are proteinuria, which is presence of protein, excess protein in the urine, as well as high blood pressure or hypertension. Now, these two, and most times, I would even say 99% of the time, that edema, those three symptoms, you will always find it in a woman with preeclampsia. Now, what are the risk factors for preeclampsia? Now, what are those things that predisposes you to coming down with preeclampsia during your pregnancy? One is multiple gestation, meaning when you have more than one baby in the womb, twins, triplets, and so on, you're at risk of having preeclampsia. Two, for people who have chronic high blood pressure prior to pregnancy, so people who are hypertensive prior to pregnancy, they are at risk of having preeclampsia. Also, if you've had previous history of preeclampsia in your pregnancies, like you've been pregnant before and your former pregnancy, or your previous pregnancy rather, you had preeclampsia, you're most likely going to experience it again. Apart from that, people who have history of preeclampsia in their family, okay, if your mother has once had preeclampsia during the course of her pregnancy, you might end up having preeclampsia, kidney disease, and in vitro fertilization. Finally, another risk factor of preeclampsia is autoimmune conditions, where the body's immunity or the body's own immune system fights against the body's cell. Okay, so that's autoimmune condition. Now, these are the risk factors. These are the things that you will see in yourself or in your family that will make you to think, oh, you're at risk of having preeclampsia. Now, how can you diagnose it? Now, one way of diagnosing preeclampsia is urine analysis or urinalysis. Now, in urine analysis, what we are checking for is the presence of protein or the absence of protein in the urine. So we have blood tests. I told you that for women who have preeclampsia, they suffer from thrombocytopenia. Okay, now so from the blood test, we're able to ascertain that, oh yes, this person has reduced level of blood platelets in the body. There's also blood pressure screening. I said One of the defining symptoms of preeclampsia is having a high blood pressure. So blood pressure screening could indicate that, oh yes, this person has preeclampsia, or it's not preeclampsia. Finally, fetal ultrasound scan. Now this scan is important because for women who are experiencing preeclampsia, their babies don't grow. Sometimes the babies don't grow to the extent at which they ought to grow. So it's from the scan you're able to monitor that, oh, there's a problem with this baby's growth. They usually experience growth retardation. That's for the baby in the womb. Now, having understood that, let's look at the complications of preeclampsia. Now, I said that preeclampsia is a complication of pregnancy. One of such complications is fetal growth restriction. That is why fetal ultrasound scan is very important, because it's able to determine whether the baby is growing as expected. So this is one complication that might arise. There is also chance of preterm labor. 98% of the time, women with preeclampsia, they tend to deliver before time. 36 weeks, 36 weeks, 35 weeks, and thereabouts. Most women have their babies around that time. Also, we have placenta abruption. Now, this is when the placenta is torn out or pulled out from the uterus. Now, the placenta is normally attached to the uterus, okay, and it's only at the time of delivery and baby is being delivered, and then the placenta that it pulls out from the uterus, which is normal. But then for it to pull out during the period of the pregnancy, when it's not time for delivery, it is abnormal. Okay, now in placenta abruption, this is what occurs, and it can happen in women with preeclampsia. Finally, we have eclampsia. Now, eclampsia is a severe form of preeclampsia. In eclampsia, the woman begins to experience convulsion, seizures, and the like. Now, what are the managements? For a woman who is having severe eclampsia, she's having seizures upon seizures upon seizures upon seizures. Now, the focus will move from her baby to the woman, and because this occurs only in pregnancy, we might try to look for a way of taking out the pregnancy, taking out the baby, so that the woman's life is being preserved. Also, if the woman doesn't have a severe form of eclampsia, and we see that it's something that can be managed, and it's not having or posing a health risk on the mother per se, what will be done is we're not going to turn and look at the gestation of the pregnancy. How many weeks is this pregnancy? If we should bring out this baby now, can this baby survive? Can we be able to manage this baby? Can this baby thrive? Do you understand? So those are the things put into consideration. Look at the severity of the condition, like I've explained. Look at the gestation of the pregnancy, and then look at the fetus in utero. Is the baby okay? Is everything fine? Look at the mother as well. So these are the factors we put into consideration when managing a patient with preeclampsia, while also trying as much as we can to bring down the person's high blood pressure. So individuals like that, they're definitely going to be on hypertensive drugs that is good for their system and the pregnancy, so that's to bring the blood pressure of the pregnancy. So usually once we've been able to manage the pregnancy up until the 37th week, we can breathe a sign of relief now that, okay, yes, once the baby is born, everything is going to be okay. No, we're not expecting any issues. All right. So, and then at this point in time, we're not going to try and see, are we doing vaginal delivery or cesarean section? Whichever is best for both mother and child is what is going to be carried out. For a woman who's already experiencing seizures, we give anticonvulsant. Now, this for people who are already experiencing complications, which I said eclampsia is one of them, seizures, setting, convulsion. So we give anticonvulsant for such a person, as well as corticosteroid to help in the development of the baby's lungs, because the baby might most likely be brought out before time. Now let's look at prevention. Now, this condition might not be preventable if you have history of preeclampsia personally. That's your previous pregnancy, you had preeclampsia. If preeclampsia runs in your family, or if you had history of high blood pressure prior to getting pregnant. Okay, but that doesn't mean you cannot prevent it from getting to a complicated phase. I don't know if you get. Now, you can prevent it from getting to a complicated phase by adhering to every instruction that you are being told by your antenatal team. Okay, very important. Even if you're a nurse, even if you're a doctor, what a doctor or your nurse or your medical team tells you, please adhere to it. Also, try to eat well, try to rest Rest, save energy for your D-Day. Also, try as much as you can to avoid anything that will stress you or make you get worried, because the most important thing when trying to bring down someone that has high blood pressure, and the most important thing in trying to bring down someone's blood pressure, especially when it's high, is apart from taking the drugs you are being given, you also have to rest. You have to sleep well. Stop worrying. Stop thinking and thinking and thinking and thinking. Even when you're taking the drugs, if you're not doing this, it's not going to go down. So they work hand in hand. I hope I've been able to educate us on preeclampsia. Okay, if there's anything I have left out in the video, or if there's anything you feel like you are not too sure about or you're confused about, let me know in the comment section below. Your questions, your recommendations are highly welcome. Please don't forget to like the video, okay? Share the video, subscribe to the channel as well. Until I see you next time, bye, love, please, and God bless you.